Greetings, brothers and sisters in Christ. At St. Thomas, we tried to, for the past year, keep you safe as we've entered into a worldwide pandemic. As you recall, we shut down for a short time and we went online with our worship services. But around July of last year, we started opening things up and we followed some protocols given to us by the Douglas County Health Department and by the CDC. And so with the vaccinations coming into effect now, and with the population feeling a little bit more freer, and with this past week with the CDC saying if you've been vaccinated, you could remove your mask outside, I think it's time for us to at least address how we're going to re-enter and start back into worship. Many of you have expressed to us that you've been thankful for the precautions we've taken, and some of you are a little bit wary about how quickly or how slowly we're going to open up. So let me take a few moments, if you will, to explain our process, because while you may feel one way, we're trying to deal with the facts on the other hand. With that in mind, as we move forward here at St. Thomas, we're going to begin the weekend of May 22nd and 23rd to make some changes in our in-person worship. We're going to start printing bulletins back in our 7:45 and 11 o'clock worship. We've learned that the exposure to the disease or the virus is not as great through passing of paper and things along that line. So also hymnals and Bibles will be reinserted back into our worship setting, especially in the sanctuary. And there'll be a designated time for offering, which we've missed. We've invited you to make the offering before you enter in or leave the worshiping space. But now we're going to put offering plates either on the altar in the sanctuary or perhaps down here in the Community Life Center by the screens and have you take those forward. We may institute in the future the bucket for the kids, which we so sorely miss, of them coming forward and offering their gift to God. We think that offering is a great opportunity, even if you give online, and to thank God for all the blessings that flow from Him each and every day. And finally, we're going to start singing again with our mask, because we know that the aerosols that come out of our mouths can easily spread around the room, so we're going to at least mask for now. But what a great joy that will be at the end of May when you join us, that we'll be able to lift our voice to God and sing. We're following something called a matrix or a dial from the Douglas County Health Department. And this is how we're going to make some of the final decisions on when we're going to discontinue some of our protocols. So the risk dial is something that you will see here. That risk dial is from low to moderate to high to severe. Currently, since July, we've been in the high. So let me tell you, last week it was at 3.0. This week it's at 2.5. We're heading in the right direction, but we need to see some changes. And the protocols that have come into that are on the screen for you. It's the positivity rate for Douglas County of COVID-19. It's the percentage of change of the numbers. It's the average number of hospitalized COVID-19 patients. It's the cases per million per day based on a 7-day rolling average. And it's the percentage of cases contacted with the last 24 hours and the percentage of cases lost to follow-up. So we want to be able to have these numbers. We're relying on our health department to give us good information. And so you will see, again, here's the low, the moderate, the high, and the severe. Since July, again, we have been in the high, and yet we're moving towards moderate. And when we go into moderate, when it reaches 4 consecutive weeks, leadership here has made the decision that we will discontinue our RSVP for in-person worship. We'll discontinue social distancing in worship. We'll open up our children and youth programs for indoor activities, events that are inside the community. And because we know it's going to take a little while, when it reaches 6 consecutive weeks, we'll no longer require our masks to be worn. Friends, come with me for a little bit. we're going to need each other, and we're going to rely on each other for this help. We know that we're never going to be in the low. We know in flu season there are still cases that flare up all over the place, and there is a risk of that. But we know that we can make it to moderate, and we know that when those moderate things happen, we'll be better as a community, safer as a community. Our bishop wrote us at the beginning of April, urging us to continue this kind of vigilance towards the end. We are almost there. And by the fall, I pray that we will be without Mass, that we will be without social distancing, and that we'll be coming out and restarting in a new and helpful way. On behalf of the leadership here at St. Thomas, I invite you to join us back in worship. I invite you to help us as we follow some of the protocols that we have in place. And I invite you to pray for this to be ending soon and to be reunited as a community in Christ.